Okay, welcome everybody. We are back for another episode of Wellness Decoded. And today's episode, we are going to be talking about the truths around estrogen. And this kind of came up recently because of some of the patients Darlene was seeing. And there's a lot of misnomers and misunderstanding around this when it comes to hormone optimization or hormone replacement therapy. And there's again, there's, like I said, there's a lot of mistruths and understanding of how it works, how it's applied, how does the optimization or the therapy actually work when it comes to estrogen. Because there's a lot of people that just stay away from hormone replacement therapy because of what's been said out on the web, on the internet and all of that. So we're going to start. And did you want to start with anything particular?
I kind of want to just talk about a patient that actually came in today, but this is not new. I see this every single day. So a patient came in today who is taking estrogen from their primary care physician, and this happens a lot. It's not, just primary. It could be your gyne doc, or it could be another functional, another hormone. So I want to educate. Okay. One of the biggest issues is this patient that came in has estrogen dominance, meaning the progesterone is completely deficient in the estrogens in 300s. So the interesting thing about that is she is on a vaginal cream, estrogen cream, that she got from her primary. And I asked, well, why? And she said, well, because he said it was necessary for estrogen deficiencies after menopause. And I was thinking, but you're not deficient, not in the least. You're very, very high. So progesterone's deficient, estrogen's dominant, and that unfortunately causes a risk for breast cancer. And as I delved deeper into her history, she has a history of her mother and her sister having breast cancer. And that's the positive breast cancer. So I just made sure that she had been taking care of her mammograms and getting those done. And thank heavens everything's fine with her. I'm ready to correct her problem, because that was scary when we saw that today. This happens every day, though. I see someone else on estrogen instead of progesterone and estrogen. They're on estrogen only. And so becoming estrogen dominant to progesterone and estrogen together, becoming estrogen dominant and not touching that progesterone puts you at a higher risk for estrogen positive breast cancer.
And this is just another example. And we always said that we don't talk negatively about other providers. And it's not that they are doing this on purpose.
Never. No,
It's a lack of education.
It's something that's readily taught.
Yeah. And so there's just, so patients are left to try to find stuff online. And some of that stuff online comes from medical doctors, unfortunately, that are ignorant. I'm not saying that in a bad way. They just are not educated.
Oh yeah, not unknowledgeable. I don't want to say ignorant at all. They're just not, they don't know this particular thing because it's never been something that they actually studied. We will put a bunch of studies at the end of this so that anybody, whoever you are, whether you're a provider, whether you're just a patient that wants more information, you just need to look at these studies. These studies are extremely important. Everything that I do is evidence-based. I don't do anything without some evidence backing it. Okay. So as we delve into this question and answer that we're going to do right now, I want you to focus on, the things that are going on in your life and what you feel is positive. And if you're having these symptoms, etc., make sure you're being seen.
Right. So you want to start with these questions?
Yes.
Okay. So just so that, again, I know enough to be dangerous. Darlene's the medical professional in our practice. When you say estrogen and estradiol, those seem to be two different words. They come from each other, but explain that so people understand.
Estrogens are E1 and E3. Estrone, estradiol, and estriol. We're going to talk specifically today about estradiol, which is E2.
E2, okay. Perfect. Okay, that sets the stage. All right, so here's the question. What is estradiol and why is it important?
It is basically the most potent form of estrogen and the one that we need the most in our body. It's key to female survival. Males need it too. Okay, don't get me wrong. It plays a crucial role in the reproductive health, which we all know. It regulates the menstrual cycle, and then it maintains tissues such as breast and uterus. Men need this in smaller amounts because it's going to help them. I call it the moisturizer of the body. It helps to lubricate things. in the body. So think of it that way.
Okay. All right. Perfect. What happens when estradiol levels are too high?
So a high estradiol level for a woman can cause irregular periods, heavy bleeding, tenderness, bloating, weight gain, mood swings, increased risk of endometriosis or fibroids, and then estrogen dominant cancers. In men, you can get gynecomastia, which is breast tissue growth, erectile dysfunction, low libido, mood swings, and infertility if the estrogen's too high.
Okay. And some of our patients come in with that situation.
Yeah, absolutely. Because they'll be put on testosterone and their testosterone will aerosolized to, I'm talking about men,
Mm-hmm.
aerosolized to estrogen. And
Yep.
so they're very, very high on their estrogens, wondering why they still have erectile dysfunction, even though they're
They're
on
yeah,
testosterone.
right.
Yeah.
Yep. Okay. So we're going to move over to what is progesterone and how does it interact with estradiol?
Yeah. So it's important to know how it interacts because a lot of people think that you can do estradiol alone, like we were talking about. So progesterone is just another key hormone for both males and females. It helps to regulate the effects of estradiol. It promotes tissue differentiation and balances estradiol's growth stimulating actions, especially in the breast and the uterus. Okay. So if you don't have progesterone, then a lot of other things kind of fall out of place.
Okay, so that's super important. All right, next one is, can imbalance between estradiol and progesterone cause health issues?
Yes. So when estradiol is high and progesterone is low, it's called estrogen dominance. Okay. And the unopposed estrogen can overstimulate the tissues, leading to issues such as breast tenderness or cysts. Okay. Irregular or heavy menstrual bleeding, mood changes and weight gain, increased risk of breast and endometrial cancers. Yeah. All of those are, that's enough, right? But all of those are extremely confusing for some people because they'll come into me saying, I have endometriosis, I have fibroids. What do I do? What do I do? Calm down. Let's check your hormones. Let's see where you are, where your ratio is. Progesterone to estrogen ratio is what we're missing a lot of the times.
Okay, perfect. In your answer, you said unopposed estrogen.
Yeah.
What does that
When
mean
it's
to
estrogen
layman's?
only and we're not focusing on the progesterone, it's unopposed. So
Got
that means that you're in menopause and your doctor puts you on estrogen only, estradiol, it's unopposed. If you are PCOS and you're very deficient in progesterone, you're unopposed again. So you're estrogen dominant just by default because the progesterone is so deficient. So you might have a normal estradiol, but your progesterone is very, very low.
Makes sense. Okay. All right. Can high estradiol relative to progesterone cause breast cancer?
Absolutely, yes. An imbalance where estradiol is elevated and progesterone is insufficient can increase the risk of estrogen receptor positive, which is the ER plus that I was talking about, breast cancer. Without progesterone to moderate estradiol's effects, prolonged stimulation of breast tissue can promote abnormal cell growth and DNA mutations. Now, I'm not saying this happens with everybody, but why take the risk? Why be imbalanced when you can be in balance?
Yep. Yep. Exactly. Is this risk backed by research?
Of course. High lifetime exposure, according to these studies that we will put at the end, to unopposed estrogen increases breast cancer risk. Low progesterone, especially during the anovulatory cycles in menopause, removes a protective buffer against estradiol's proliferative effects. So there's certain time during the month when your progesterone goes too low and your estrogen goes too high, and that's when you're starting that risk. Okay, so that's what we can look at. And that's why we check during that luteal phase. Your hormone therapy using estrogen alone without the progesterone is linked to a higher risk of breast cancer, particularly in women with a uterus. Okay.
Okay. How can I check if I have this hormonal imbalance?
Have your estradiol and progesterone levels checked. Ideally, around the 21st day of your cycle, which is the mid luteal phase, evaluate your symptoms with a hormone specialist or an endocrinologist. There's a lot of endocrinologists who have studied postmenopause, premenopause, hormones, and they're really, really good at it. And track changes over time to understand your patterns as well. So keep track of it, keep a diary. Your phone's always with you. So keep your diary in your phone if you
So
have to.
I just want to pause here for a second because checking your hormones and going to your primary physician, sometimes they're going to check and you're inside this little box. You may be high normal, low normal. You're okay. Talk a little bit about optimization and why coming to a functional hormone specialist or an endocrinologist that specializes in that, it makes sense.
Well, there's a reference range on all the labs, right?
Right.
So if you're within the reference range, it's going to come back as normal usually, okay? Because the reference range is so huge. It goes from zero point 0.0 to sometimes 400 on estradiol, depending on what phase you're in on your cycle. Same with progesterone. It goes from 0 to a very high, like 20 sometimes. So what they're looking at can show normal, but the ratio between the progesterone and the estradiol can be so off that that puts you in that huge risk factor. So bring me your labs if you don't feel comfortable with those results. And if you are a primary that's listening to me right now, call me. I'll give you as much information as you need, and we can talk about what the ratio needs to be.
Right.
Okay, because I am 100% willing to get everybody. I think a lot of our problems, actually, these PCOS girls, PMDD girls, these very depressed, anxiety ridden, insomnia patients, girls, boys, everybody can be fixed through hormone optimization.
Okay.
Okay.
All right. How is the imbalance treated or managed?
Well, there's a few different treatments. Bioidentical hormone therapy is obviously the very, very best. It balances your estrogen and progesterone. Those prescriptions usually go to a compounding pharmacy. There are some that we can send to a regular pharmacy that have been approved by insurance, right? There are some aromatase inhibitors or dimmers that we can give to reduce that estrogen if the estrogen's too high. I like a particular dim that is specific to estrogen. I love it and it works really well. It never is going to knock you down too far. And then lifestyle changes. So, weight management, reducing alcohol, stress management, and improving liver function. So, alcohol, high alcohol intake, and cortisol levels going up and down based on that alcohol intake. This could include people who are addicted to drugs. You are going to cause a huge imbalance in your hormones.
Okay.
Because they're not going to be able to metabolize properly.
Right. Yep. And it's all about hormone optimization. And we talk about HRT, and that's kind of been known as the term or the phrase out there. But now this new kind of lingo of hormone optimization, which makes sense. We're more optimizing. Yeah. To make those levels match up and where they need to be. Okay. Our last question is, what should I do if I'm on estrogen therapy?
Okay. So if you're on estrogen therapy, make sure that the progesterone is also is prescribed, whether or not you have a uterus. Okay. There's a lot of misnomers out there about if you have a uterus. If you don't have a uterus, you shouldn't be on progesterone. Not true. Progesterone is super important for anxiety, stress, depression, and sleep, even if you don't have a uterus. I believe even more so. I have noticed that the patients without the uterus have zero progesterone. They need it more than the people with the uterus making a little bit. Okay. So this is extremely important. It reduces the risk of cancer and helps maintain the hormonal balance. So always, always consult a hormone specialist for that individualized care in regards to, where am I and where should I be? Because you are getting care from somebody and that might be perfect care, but you should bring it to a hormone specialist to make sure that it is actually working. If it's not, then, kind of come back full circle, redraw your labs, maybe even get off the hormones that you're on and redraw in a month, or bring those actual hormones that you're on, or take a picture of it and send it, and then make sure that we know exactly how much you're taking so that it can reflect in your labs, and then we can go from there.
Right. Okay. All right. Well, that was a lot of good information. And like we talked about at the beginning, there's a lot of misnomers out there. There's a lot of misinformation that's flying around. We get so many calls. I've spoke to people over the phone that just have been really misinformed. And Darlene has been able to educate them and really get them on the right track. And we've got patients that are just saying, I've been seeing doctors for years and years and years, and nobody's been able to help me. And so, there is definitely proof in the notes of our podcast today. We are going to be putting links to all these references and referencing these tests and so that you can do your own research. I think that's going to be really important. So what else?
I mean, I guess I never feel like you ever want to do something that you're not comfortable with. So let's say that I think you should be on estrogen. You don't have to. There's phytoestrogens, there's food. There's estrogens in food, in plants. If I feel like you need it for things like estrogen or vaginal dryness or risk cardiac issues that you might have going on, osteoporosis, osteopenia. We could talk about some more than just as natural as the bioidentical. We can go more into food estrogens as well and talk about that. And then the progesterone, obviously, we'll talk about making sure that they are completely balanced. Balancing these hormones is the most important thing you can do when it comes to optimization. I know we didn't talk about testosterone at all, but that can you can have it or not. When it comes to estrogen and progesterone, you have to have you have to have both of them together.
Okay. Perfect. All right. Well, that's it for today with this one. We definitely would love for you guys to like this, share it. Also, please, if you feel so inclined, to subscribe to our channel. The more we can get support from everybody out there, the more we can continue to do this and even bring on some guests. We recently had done some of that with some of our patients, and that's going to be happening pretty soon. We'll be bringing on some more people and doing some interviews, things like that. So we definitely enjoy doing this, and you guys got to see Teddy sleep a little bit. He's our little mascot, but definitely we'll have more on its way, and we'll be coming back to you. And that's it for a wrap.
Yep.
Okay.
That's a wrap. Love ya.
Love ya.
Bye.